Millions of people are injecting one of the most powerful metabolic drugs ever created just to drop 10 pounds for a wedding. Celebrities swear by it. Social media is obsessed with it. And many are jumping on Ozempic without fully understanding the consequences. A large 2022 trial showed that within 1 year of stopping Ozempic, participants regained two-thirds of their lost weight, along with reversal of the lab markers back to the pre-treatment levels. Because Ozempic is not a permanent weight loss drug. It is a metabolic hormone therapy. It only works while you take it. In the next few minutes, I'll walk you through 3 situations where these drugs can be truly life changing, and 6 situations where they can create a lot more harm than benefit. Hello, everyone. Dr. Neha Garg here. Let's break down Ozempic like both a clinician and a healer. First is its mechanism of action. To understand the risks, you have to understand how it works. Ozempic is a GLP-1 receptor agonist. It mimics a hormone called GLP-1 that your gut naturally produces. When you inject it, it does 3 key things. Number 1 is it slows down stomach emptying. Food stays longer in your stomach, so you feel full longer and have fewer cravings. Second, it suppresses appetite at the level of the brain. It acts on the hypothalamus, dialing down the hunger signals directly. And third is it improves insulin regulation. It helps your pancreas release insulin only when needed, and it reduces excess glucose output from the liver. So the net effect, you feel fuller, you eat less, and your blood sugars, they stabilize. But here's the problem. When the drug is stopped, the system rebounds. Hunger signals return with an appetite that is stronger than before. The weight comes back within weeks, and metabolic markers drift back to the previous baseline. Now, here's the real question, one that Ayurveda asked for over 3,000 years. Are you fixing your metabolic fire, your internal Agni, or are you outsourcing your metabolism to a temporary external fix? Because a crutch weakens your natural system over a period of time. It is not true healing, it's a metabolic debt. Now, I'm not trying to demonize these drugs. For the right patient, these can be truly life-saving. So let's look at the 3 FDA-approved scenarios where Ozempic can be truly beneficial or life-changing. Number 1 is uncontrolled type 2 diabetes when lifestyle and oral medicines have already failed. Hemoglobin A1C remains above 8, fasting sugars above 200s with increasing doses of insulin. This is a metabolic emergency territory where Ozempic can reset the system. Second indication is severe obesity with complications. BMI more than 30 with conditions like sleep apnea, fatty liver, or prediabetes. Not cosmetic weight loss, but organ damage in process. Third indication is for cardiovascular disease. A 2023 SELECT trial showed a 20% reduction in major cardiovascular events. So, for someone with metabolic syndrome and a heart attack, this is not optional, it's protective. In these patients, Ozempic can be a powerful metabolic reset. And yes, this is where I would prescribe it as well. So, when should you not use Ozempic? This is where social media gets it dangerously wrong. If you fall into any of these 6 categories, then please pause and rethink. First is if you have severe reflux or gastroparesis. Ozempic slows stomach emptying, so it can turn a mild reflux into hospital-level vomiting and abdominal pain. The JAMA pharmacovigilance data in 2023 showed that these cases are rising, and this is the ER visit that I see most often in my practice. Second is a personal or family history of medullary thyroid cancer. This is a black box FDA warning, absolute contraindication, so no exceptions. Third is cosmetic weight loss. If you're trying to lose 10 to 15 pounds just for appearance, you are exposing yourself to risks without true medical benefits. Your body can solve this easily with diet and lifestyle changes within months. You do not need hormone therapy for this. Fourth is ultra processed diet. This is the hidden danger. If you continue eating highly processed foods while you are on Ozempic, you become what we call skinny fat. You will lose muscle faster than fat, your metabolism slows down further, and you become weaker than where you started. Fifth is if you're already lean. Up to 40% of the weight loss on Ozempic is lean muscle compared to 25% with lifestyle methods. In lean individuals, these medicines mean muscle wasting, weakness, higher risk of side effects like pancreatitis. Sixth is pregnancy or pregnancy planning. There is just insufficient safety data for this situation, so avoid completely. The big takeaway is that Ozempic is not a cure, it is a metabolic crutch. When your metabolism is overwhelmed, yes, then it can help. But when it is not, it can quietly create long term damage. The people it helps, it truly helps. The people it harms slowly, often unnoticed until it's too late. Now imagine this instead. What if you could increase your own GLP 1 naturally? No high monthly costs, no side effects, no rebound weight gain. This is not a fantasy, this is your physiology working the way it is designed. There are 5 specific foods, most likely already in your kitchen, that can activate the natural GLP 1 system. We'll break down these 5 foods in the next video, which will be coming up next Friday. If you don't want to miss this, then please hit the subscribe button below. And if this video gave you clarity, then please share it with someone considering Ozempic. Not to scare them, but to help them ask the right question. Because the real question is not, can I take Ozempic? The real question is, do I actually need it? Till next time, stay balanced, stay healthy, stay well.